Hi everyone, I am Dr. Himadri. So let's talk about calcium vitamin D3 metabolism. So you must understand what is the normal value of calcium. The normal value of calcium in the blood is 8.7 to 10.2 mg per dl. Okay, and in this calcium we have free calcium and also the bound calcium. So what is free calcium? The calcium that is freely available in the blood, and the bound calcium is the calcium which is bound to the albumin molecule. Okay, so this is your albumin. In the albumin, remember there are two sides of binding, and the first of all is the H plus binding. Okay, in the albumin we have two sides. H plus can bind in the albumin as well as calcium can bind in the albumin. So there are two things that are possible. In acidosis, what happens? The H plus is increased. When H plus is increased, it will bind in the albumin. Therefore, it will displace the calcium within the blood. Therefore, it will lead to a excess amount of the calcium available in the blood. This is called as hypercalcemia. And on the other hand, if there is alkalosis, that is reduced amount of H in the H plus in the blood, automatically the H plus concentration reduces, and therefore what happens? The calcium from the normal circulation goes and bind with the albumin, and therefore you will be having the hypocalcemia. Okay, so there is another model which is called as 3 hormone 3 organ model. 3 hormone means PTH, vitamin D3, and also calcitonin, and here the organs are bone, GIT, as well as nephron, that is kidney. Okay, and in PTH and vitamin D3 or vitamin D, they are responsible for increase in calcium within your blood, whereas calcitonin is responsible for reduced amount of calcitonin. Okay, okay. So let's understand the PTH regulation, that is parathyroid hormone. So parathyroid hormone is produced from your parathyroid gland. Okay, so from where the story actually starts? The story actually starts from your calcium. If there is reduced amount of calcium, remember, if there is reduced amount of calcium, it goes and stimulates your calcium sensing receptor present in the parathyroid gland. Okay, actually calcium sensing receptor is the receptor. If there is high amount of calcium, it basically inhibits the production of PTH, whereas if there is reduced amount of calcium present in the blood, it will, via calcium sensing receptor, the PTH production, that is the PTH release, increases. You can remember, like, the calcium sensing receptor is actually like a sensor present in your blood which can always sense the amount of calcium present in the blood. If there is reduced amount of calcium, PTH secretion increases. Okay, PTH secretion increases. So what are the roles of PTH in the blood? So what happens? PTH actually goes and control your this naughty hormone, this naughty enzyme. Actually, what is the name of this enzyme? The name of this enzyme is 1 alpha hydroxylase. So the name of the enzyme is your, this is your 1 alpha hydroxylase. Okay, so what this enzyme actually does, it converts your 25 hydroxycholecalciferol to 125 dihydroxycholecalciferol. This is the active form of vitamin D. So this vitamin actually, what is the role of this vitamin? Vitamin actually goes and binds to the receptor present in your duodenum. Remember, this is your GI tract, and this is the duodenal cell. This is the duodenal cell. In the duodenal cell, what happens? It basically expresses, it leads to more expression of this TRPV6. Via TRPV6, your calcium are basically absorbed. Look, these are your calcium molecule. So the calcium molecule absorption increases via TRPV6 upregulation, as well as these are your cal binding. Cal binding means they bind with the calcium molecule. Once these are absorbed from the duodenum, they bind with this calcium molecule and also deliver this calcium molecule to other membrane transporter. This vitamin D3 leads to more expression of this TRPV6 as well as cal binding as well as calcium ATPase. So this is your calcium ATPase. Okay, it basically throws the magnesium 2 plus as well as calcium 2 plus into the blood. So what is the main issue? The calcium is reduced, therefore PTH increases. PTH leads to overexpression or stimulation of this rate limiting enzyme called as 1 alpha hydroxylase. So this is 1 alpha hydroxylase, the naughty enzyme. It basically, you know what, they are the master player. they basically converts the 25 hydroxycholecalciferol to 125 dihydroxycholecalciferol, that is the active form of vitamin D3. This active form of vitamin D goes and binds in your gut in the duodenum and leads to overexpression of TRPV6, calbindin, and also calcium 2 plus ATPase. And automatically what happens, calcium absorption and calcium absorption as well as the phosphate absorption is increased in the blood. And also what they are doing, so this PTH is having three actions actually. Number one action is actually we have already dealt. The number two action is, look here, this PTH actually goes into your bone is like your bank, when you have reduced amount of calcium, it's like reduced amount of money present in your pocket. So what you do, you just go you just tell your father, and your father gives this maybe from bank. Okay, so when there is reduced amount of cash in your pocket, you need to mobilize the cash from the bank. So your bank is your, basically bone is your bank. Okay, so PTH goes and basically acts on this PTH receptor which is present over the osteoblast. So osteoblast releases another substance which is called as a rank ligand. This rank ligand goes and stimulates osteoclast. Clast are like the cutter, they are bone cutter. They cut the bone with acidic pH, they cut the bone, and eventually leads to increased amount of calcium and phosphate mobilization from the bone. So they mobilizes calcium as well as phosphate. And on the other hand, this PTH also inhibits another molecule which is called as osteoprotectin. Remember, osteoprotectin means they protect the bone. They protect the bone from degradation or from resorption. Where the PTH, therefore, PTH inhibits this OPG or the osteoprotectin. So PTH leads to overexpression of rank ligand and overwork of this osteoclast, and eventually calcium and phosphate increases in blood. So this is the number two action. Number three action of this phosphate is like phosphate or this PTH. So we can remember like the PTH means phosphate throwing hormone. It throws out the phosphate, whereas only reabsorb the calcium. So from distal tubule, it reabsorbs the calcium as well as throws the phosphate within your urine. So there are three functions. You are very clear about it. Number one is they stimulates 1-alpha hydroxylase and vitamin D3. Vitamin D3 leads to more absorption of calcium, more absorption of phosphate. And number two is that they act on the osteoblast, and from osteoblast rank ligand, they stimulate your osteoclast and eventually calcium and phosphate coming to your blood. So PTH increases calcium. You had less amount of money in your pocket. PTH leads to increased amount of money, that is restoration of this money. So it leads to increased amount of calcium within the blood. But what happens, it reabsorbs the calcium but throws out the phosphate. Okay, so we can also remember like that, PTH means phosphate throwing hormone. Okay, so now next about vitamin D. Vitamin D is actually an inactive form of vitamin D is present in your skin. Okay, it is called as 7-dehydrocholecalciferol. If the light is placed over it, like if the UVB ray, that is 280 to 320 nanometer rays, fall over it, this 7-dehydrocholecalciferol actually converts into cholecalciferol. This cholecalciferol eventually goes into your blood. So this is your blood stem, this is your blood stem. Cholecalciferol goes into your blood. In the blood, it basically enters within your liver. In the liver, we have another enzyme which is called as 25-hydroxylase. It leads to hydroxylation of this cholecalciferol molecule, leading to formation of 25-hydroxycholecalciferol. So this is 25-hydroxycholecalciferol. This 25-hydroxycholecalciferol actually enters in your proximal convoluted tubule of this kidney. So this is your nephron, and this is your PCT, actually proximal convoluted tubule. 25-hydroxycholecalciferol basically comes here, and this is your once again the naughty enzyme, the rate limiting, the main player in this game, that is 1-alpha hydroxylase enzyme. This is your 1-alpha hydroxylase enzyme that converts 25-hydroxycholecalciferol into 125-dihydroxycholecalciferol. This is also called as active form of vitamin D. And you also know, I have already discussed, this active form of vitamin D basically comes here and leads to overexpression of TRPV6, calbindin, and calcium 2 plus ATPase, and leads to more absorption of calcium and phosphate as well as magnesium from your GI tract. As well as this vitamin D also goes to your bank, And another thing, the vitamin D is also stimulated when there is less amount of calcium. So you have less amount of money in the pocket, PTH is stimulated as well as vitamin D3 is stimulated. Okay, so this vitamin D3 comes into your bone bank and it once again stimulates the osteoblast and rank ligand and leads to overwork of this osteoclast, leads to calcium and phosphate both are increased in your blood. So this calcium and phosphate also goes via this nephron, but the main difference is that the phosphate throwing hormone or PTH, parathyroid hormone, they traces out phosphate, whereas vitamin D, they leads to both reabsorption of calcium and both reabsorption of phosphate. So therefore calcium and phosphate concentration increases in blood, but in PTH only calcium concentration increases but the phosphates are thrown out. Okay, please remember these things is. And now we have another concept, that is FGF23. What is FGF23? FGF23 is actually your fibroblast growth factor 23. This is another molecule. This molecule is actually coming from your bone. Okay, when this FGF23 is stimulated, when there is increased amount of phosphate, let's say you have CKD, that is chronic kidney disease, and not able to pass the phosphate, potassiums and other molecules, therefore the phosphate is increased into your blood circulation. This increased amount of phosphate goes and stimulates this FGF23 molecule. FGF23 molecule has three main action via clotho basically it acts via clotho. It acts over the parathyroid gland. When there is increased amount of phosphate, the main motto of this work is to reduce the phosphate in the blood. How can you reduce it? You can inhibit the parathyroid gland. It goes and inhibit this PTH formation. Okay, and another thing, this FGF23 also inhibit your vitamin D as well as it inhibits the reabsorption of phosphate. So the phosphate is actually basically reabsorbed in the proximal convoluted tubule by sodium phosphate transporter, that is NPT, sodium phosphate transporter 2A. Okay, so they basically goes and inhibit this sodium phosphate transporter 2A, FGF23. Therefore what happens, phosphate are basically thrown away into your urine. So we started with increased phosphate and FGF23 leads to excretion of phosphate in the urine. Thank you.